Hello everyone. A heart attack is always a medical emergency, but what if you find yourself completely alone when it happens? For seniors, the risk of complications can be even higher, making it crucial to know exactly what steps to take. In this article, we'll walk you through understanding heart attacks, recognizing warning signs, and immediate actions you can take to increase your chances of survival when no one else is around. Let's get straight to what you need to know. 1. Understanding why heart attacks happen. A heart attack, also known as a myocardial infarction, occurs when the flow of blood to the heart is blocked. This blockage typically happens due to the buildup of plaque in the coronary arteries. Over time, fatty deposits, cholesterol, and other substances form plaque along the arterial walls. When a plaque ruptures, it can form a blood clot that obstructs blood flow to the heart muscle. Without oxygen-rich blood, the affected portion of the heart begins to die, leading to what we know as a heart attack. The role of age and other risk factors in seniors. As we age, our blood vessels naturally become more rigid and less efficient at transporting blood throughout the body. Many seniors also live with additional risk factors, such as high blood pressure, high cholesterol, diabetes, or a history of smoking. All of these contribute to plaque buildup. Furthermore, a sedentary lifestyle and certain genetic factors may increase heart attack risk. The importance of awareness. For seniors, awareness is absolutely critical. Recognizing the root causes and risk factors behind a heart attack means you can take preventative steps in your day-to-day life. Yet even with the best of preventive measures, heart attacks can still happen. That's why this article focuses on what to do if you find yourself alone and experiencing the first signs of a heart attack. When no one else is around, taking quick and correct actions could make the difference between life and death. As we move forward, we'll discuss how to recognize the symptoms, what immediate steps to take, and how to manage the situation until help arrives, or until you can get yourself safely to professional medical care. 2. Recognizing the warning signs of a heart attack. One of the most powerful tools in your arsenal is the ability to recognize the early signs of a heart attack. This can be especially tricky for seniors because some symptoms may be mistaken for indigestion, muscular pain, or the general aches and pains that come with aging. Being able to differentiate these signs quickly is crucial. Classic symptoms. 1. Chest pain or discomfort. The most common warning sign is discomfort in the center of the chest that lasts more than a few minutes or that goes away and returns. It often feels like pressure, squeezing, fullness, or an intense tightness. Some people describe it as feeling like a heavy weight on their chest. 2. Shortness of breath. Difficulty breathing either on its own or in conjunction with chest pain is a common symptom. You may feel as though you can't catch your breath, even while resting. 3. Upper body discomfort. Pain or discomfort can radiate to the shoulders, arms, especially the left arm, back, neck, or jaw. You might feel a general heaviness or a dull ache. Less obvious symptoms. 1. Nausea and lightheadedness. Feeling dizzy, lightheaded, or nauseous can be easy to dismiss as gastrointestinal issues or dehydration. However, when paired with any form of chest discomfort, this can be a sign of cardiac distress. 2. Cold sweats breaking out in a sweat for no obvious reason, especially a clammy cold sweat, can be a red flag for a heart attack. 3. Unexplained fatigue. Seniors may feel fatigued or exhausted from daily tasks at times, but if there's a sudden, extreme fatigue that comes out of nowhere, pay attention. This could be an early or subtle heart attack symptom. Women and atypical presentations. It is worth mentioning that women, including senior women, may experience atypical heart attack symptoms. These can include sharp, fleeting pains rather than the typical pressure or heaviness, or symptoms like pain in the jaw or back without significant chest discomfort. Why seniors must pay extra attention. As a senior, you might be used to various aches and pains, or you may be on medications that mask certain symptoms. You could also have existing health conditions that make it harder to differentiate a heart attack from something else. Never ignore chest pain or persistent discomfort, even if it feels mild. If you catch the symptoms early and act fast, you have a better chance of minimizing heart damage and saving your own life. 3. Immediate steps to take if you suspect a heart attack. When you suspect a heart attack and you're alone, you need to act both quickly and calmly. Remember, every passing minute can lead to further damage to the heart muscle. Here is a step-by-step guide on what to do in those critical moments. 1. Call emergency services immediately. The very first thing you should do is call emergency services, 911 in the US, or the equivalent in your country. If you have a phone nearby, don't hesitate. Explain your situation clearly and concisely, letting them know that you're experiencing severe chest pain, potential heart attack symptoms, and that you're alone. Keep the phone speaker on if possible, so you can continue to follow their instructions hands-free. Have important information ready. It might be helpful to keep an updated list of medications, allergies, and health conditions in an easily accessible spot. If you're alone and in distress, you want to be able to provide first responders with vital information without exerting too much effort looking for it. 2. Sit down and stay calm. Stress and panic can exacerbate heart attack symptoms by increasing your heart rate and blood pressure. Although this is an extremely tense situation, it is critical to stay as calm as possible. Sit down in a comfortable position, ideally with your back supported, rather than lying completely flat. This posture helps reduce strain on the heart and assists with breathing. 3. Chew an aspirin, if advised by your doctor. If you've previously been advised by your doctor to take aspirin in the event of heart symptoms, and you're not allergic, chew a full-dose aspirin, usually 325 milligrams, or a low-dose one, 81 milligrams, as recommended. Chewing helps the medication get into your bloodstream faster, which may help slow clot formation. However, this advice only applies if your healthcare provider has given you the green light to do so. Some people have conditions or are on medications that make aspirin use risky. 4. Loosen any tight clothing. If you're wearing a belt, tight pants, or a constricting shirt or bra, loosen them to ease your breathing and improve circulation. 5. Avoid excessive physical activity. You might feel the urge to walk it off or get up to fetch something, but movement can strain your heart. If possible, keep your phone and medications close to you at all times to avoid unnecessary exertion. 6. Stay warm and comfortable. Sometimes during a heart attack, you might experience chills or cold sweats. Keeping a light blanket or warm clothing nearby can help maintain a comfortable body temperature, which may provide a small sense of relief while awaiting help. 7. Prepare for paramedics. If you can do so without straining yourself, unlock your door or secure a door key in a visible spot. This way, emergency personnel can enter quickly without being delayed by locked doors. If you can't reach the door, stay on the phone to inform the dispatcher of your location within the house. Remember that no matter how mild you suspect your symptoms to be, it's always better to err on the side of caution. Time lost can equal heart muscle lost, so staying prepared and knowing these steps in advance will give you the best chance of survival. 4. Practical self-help techniques when you are alone. Being prepared for a worst-case scenario can empower you and reduce panic if you ever find yourself alone during a heart attack. While calling emergency services and following the general steps above are paramount, here are additional strategies that may help you cope until professional help arrives. 1. Controlled breathing exercises. During a heart attack, anxiety and panic often cause rapid, shallow breathing. This not only increases your heart rate, but can also lead to hyperventilation, making it harder for you to remain calm. How to do it? Inhale slowly through your nose for a count of 4, feeling your abdomen expand. Then exhale gently through your mouth for a count of 4. Repeat this cycle, focusing on each breath. Why it helps? Controlled breathing lowers stress levels and can assist in stabilizing your heart rate and blood pressure, potentially reducing the strain on your heart. 2. Use a medical alert device. If you live alone, consider wearing a medical alert device. Many come with a button you can press to call for help. If you're having a heart attack and can't reach your phone, pressing the alert button can quickly connect you to an operator who can dispatch emergency services. 3. Engage in gentle positioning. Some seniors find that lying on their left side or reclining with pillows behind them can alleviate discomfort. However, many experts suggest sitting upright or leaning slightly forward, as it can help with both breathing and reducing pressure on the heart. Choose a position that is the most comfortable for you, and that doesn't increase pain or shortness of breath. 4. Avoid cough CPR. Misconceptions. You may have heard rumors about cough CPR, a technique where you supposedly keep yourself conscious by coughing vigorously during a heart attack. However, major health organizations do not recommend it for untrained individuals, especially when alone, as it can do more harm than good. If you are experiencing severe chest pain or suspect a heart attack, focus on calling emergency services, taking aspirin, if appropriate, and practicing controlled breathing. 5. Stay mentally focused and alert. It can be easy to drift into a haze of panic or confusion, especially if you're in severe pain. Try to keep your mind focused on a single goal, getting through until help arrives. Some people find it helpful to repeat a calming mantra or prayer, or to visualize medical help arriving. Maintaining mental alertness may help you respond more quickly if your situation changes. 6. Reach out, if possible. Even though you're alone, you might be able to call a neighbor or family member after you've contacted emergency services. A quick phone call or text message stating, "I'm having a heart attack, please come now," could be life-saving. If you can't talk, many smartphones allow you to send an SOS text or share your location automatically. Setting up these features in advance can be a literal lifesaver in an emergency. 7. Monitor your symptoms. If you have a blood pressure monitor or a pulse oximeter at home, you can try to track your vitals, only if it doesn't cause more distress. Keep track of your breathing difficulty, pain intensity, and any changes in symptoms. This information can be invaluable to emergency responders. By having these practical self-help techniques in mind, you're preparing yourself for the moments when seconds matter most. While none of these methods can replace professional medical treatment, they can help stabilize your condition until paramedics arrive. 5. Medication and over-the-counter options. In many cases, heart attack patients benefit from specific medications that help reduce the severity of the attack or assist in recovery. Understanding what you can safely take in an emergency situation and what you should avoid can be a lifesaver, especially for seniors who may already be on various prescription drugs. 1. Aspirin, your first line of defense. As mentioned earlier, aspirin is often recommended for suspected heart attacks because it helps slow or prevent blood clotting. If you've received prior approval from your doctor to take aspirin, keep a supply of it in an easy-to-reach place. The recommended approach for suspected heart attacks is to chew the tablet, as it gets into your bloodstream faster than swallowing it whole. Considerations: if you have a bleeding disorder, are on blood thinners like warfarin, heparin or apixaban, or have a known allergy, aspirin might not be safe for you. Always clarify your individual guidelines with your healthcare provider in advance. 2. Nitroglycerin, if prescribed. If you've been diagnosed with angina or coronary artery disease, your doctor may have prescribed nitroglycerin tablets or spray for chest pain. Nitroglycerin helps dilate the blood vessels, improving blood flow to the heart. If you suspect a heart attack and are prescribed nitroglycerin. How to use: place 1 tablet under your tongue, or as instructed by your doctor. If your pain does not subside within a few minutes, you might be advised to repeat the dose. However, you should not exceed the dosage prescribed by your doctor. Important note: if you have already taken erectile dysfunction drugs, such as sildenafil, within the last 24 to 48 hours, you must not use nitroglycerin without explicit medical guidance, as it can cause a dangerous drop in blood pressure. 3. Avoid non-steroidal anti-inflammatory drugs, NSAIDs. Other than aspirin, over-the-counter pain relievers like ibuprofen or naproxen are not recommended during a suspected heart attack. These drugs can interfere with aspirin's blood-thinning effects and may even worsen cardiac outcomes. 4. Avoid sedatives. While anxiety might be overwhelming during a heart attack, avoid taking sedatives or anti-anxiety medications unless explicitly guided by a medical professional. Sedatives can lower your blood pressure and slow your breathing, which can complicate an already critical situation. 5. Beta blockers, if you're already on them. Some seniors are on daily beta blockers for hypertension or other cardiac conditions. If you normally take a beta blocker at a specific time, do not skip it, but also do not double dose in hopes of stopping the heart attack. Stick to your regular schedule unless instructed otherwise by your doctor. 6. Keep medications organized. Many seniors have a pill organizer for daily medications. In case of a heart attack, you want easy access to aspirin or any emergency meds your doctor has recommended. Make sure labels are clear. Keep medications in clearly labeled containers. Easy to grab. Store them in a place you can quickly reach, such as a nightstand, kitchen counter, or an end table by your favorite chair. Consult your healthcare provider. During regular checkups, confirm which medications can be safely taken in a heart attack scenario. 7. The bottom line on medications can help you survive a heart attack, but they must be used correctly. Misuse or mixing the wrong medications can do more harm than good. The best approach is to have a personalized heart attack emergency plan discussed in advance with your doctor. This plan should detail which medications to take, in what dosage, and when to take them if you suspect a heart attack. 6. Communicating with emergency services. While alone, when you dial 911 or your local equivalent, the dispatcher will ask you specific questions to assess your situation. They might also give you instructions on what to do until help arrives. Here's how to make the most of that conversation. 1. Prepare to speak clearly. It can be extremely challenging to speak calmly while experiencing a heart attack, but clarity is crucial. State your situation succinctly, your location, provide your address, floor or apartment number if relevant, and any helpful landmarks. What is happening? Briefly describe your symptoms. I'm experiencing severe chest pain and shortness of breath. I believe I'm having a heart attack. Relevant medical history. If you can, mention any known heart conditions or relevant history. I have a history of angina, or I'm diabetic. 2. Don't hang up unless directed. Stay on the line until the dispatcher tells you it's safe to hang up. They may continue to ask questions, provide instructions like taking aspirin or checking your breathing, or offer support to keep you calm. The dispatcher might also ask for details about your condition, such as whether the pain is spreading to your arm or if you have trouble speaking. 3. Use speakerphone. If you can, activate your phone's speaker function. This allows you to keep both hands free to follow any instructions or tend to your comfort, e.g., loosening clothing, taking medication. It also means you don't have to hold the phone to your ear, which can be physically taxing if you're feeling weak. 4. Relay information about accessibility. If you live in a gated community, have a locked front door or a confusing building layout, let the dispatcher know. For instance, the key is under the doormat, or the gate code is 1234. These small pieces of information can save precious minutes when paramedics arrive. 5. Ask for first aid guidance. If possible. Some dispatchers are trained to walk you through first aid steps. While you're waiting for paramedics, they might remind you to take aspirin, if appropriate, help you focus on breathing, or guide you to a more comfortable position. 6. Keep an eye on battery power. If you're using a cell phone, be mindful of your battery level. Use any battery-saving techniques you know, dimming the screen or temporarily turning off other apps, to ensure your phone doesn't die mid-conversation. 7. Final tips on emergency communication. Stay calm. The calmer you sound, the easier it is for the dispatcher to understand you. Speak slowly and clearly. Repeat important information, like your address, to confirm the dispatcher has it correct. Follow instructions. If they tell you to do something specific, like unlocking your door, try your best to comply without overexerting yourself. Being alone during a heart attack can be terrifying, but good communication with emergency services can drastically improve your chances of survival. 7. Long-term prevention and lifestyle adjustments. Surviving a heart attack starts long before the emergency. Adopting heart-healthy habits can reduce your risk of experiencing a heart attack in the first place. For seniors, these preventative measures become even more important, as the body's resilience can be lower and the recovery period longer. 1. Maintain a balanced diet. A diet rich in fruits, vegetables, whole grains, lean proteins, and healthy fats like avocados and nuts can help keep your cholesterol and blood pressure in check. Seniors should aim to limit their intake of processed foods, saturated fats, and excessive sodium. Heart-healthy foods, oats, berries, leafy greens, beans, and fish like salmon or mackerel, rich in omega-3 fatty acids, are excellent options. Portion control. As metabolism slows with age, portion sizes become crucial. Overeating can lead to obesity and higher heart attack risk. 2. Stay active. Within your limits. Regular physical activity strengthens the heart muscle, improves circulation, and helps maintain a healthy weight. But exercise must be tailored to your ability, especially if you have conditions like arthritis or mobility challenges. Simple exercises, walking, water aerobics, or gentle yoga can be beneficial for seniors. Consult your doctor. Before starting any exercise routine, get a green light from your healthcare provider. 3. Monitor your blood pressure and cholesterol. High blood pressure, hypertension, and high cholesterol are two of the most significant risk factors for heart disease. Seniors should regularly check these metrics at home, if possible, and during medical appointments. Medications. If you're prescribed medications to control blood pressure or cholesterol, consistency is key. Lifestyle support, diet, exercise, and weight management can significantly improve these numbers. 4. Manage diabetes. Effectively uncontrolled diabetes can damage blood vessels, increasing the risk of plaque buildup. Proper diabetes management through diet, medication, and monitoring blood sugar can mitigate these risks. Regular checkups. Work closely with your healthcare provider to adjust insulin or oral diabetic medications as needed. Blood sugar monitoring. Keep track of your levels to avoid dangerous highs or lows, which can strain the cardiovascular system. 5. Quit smoking, limit alcohol. Smoking damages arteries and reduces oxygen in the blood, accelerating plaque buildup. If you smoke, consider seeking a cessation program. Alcohol should also be consumed in moderation, as too much can raise blood pressure and contribute to heart problems. 6. Keep stress in check. Chronic stress causes spikes in cortisol and adrenaline, hormones that can elevate blood pressure and strain your heart. Techniques like meditation, deep breathing, gardening, or even talking to a friend can help manage stress levels. 7. Regular medical screenings. Stay on top of annual checkups and screenings. These appointments can catch early warning signs of heart problems or other conditions that might complicate heart attack risk. ECG and echocardiograms. These tests assess heart function and can detect abnormalities early. Blood tests. Your doctor may recommend checking biomarkers that indicate heart health, like C-reactive protein, CRP. 8. Build a support system. Having friends, family, or a community network can encourage you to stay active, motivated, and accountable. Beyond emotional support, a robust social circle can be invaluable during emergencies. 9. Consider cardiac rehabilitation. If you've already experienced heart issues or a previous heart attack, cardiac rehabilitation programs can help you transition to a safer, more heart-friendly lifestyle. These programs often include supervised exercise, nutritional counseling, and emotional support. 10. Keep your emergency plan updated. As part of your prevention strategy, maintain an up-to-date list of emergency contacts, medications, and relevant medical data. Place it somewhere easily accessible to you or paramedics if an emergency arises. By focusing on these long-term lifestyle adjustments, you can reduce the likelihood of a heart attack and improve your overall quality of life. This preparation will also put you in a stronger position if a heart attack does occur. 8. Psychological preparedness and stress management. Being mentally prepared can make a significant difference in how you respond to a heart attack when alone. Stress and anxiety not only strain your heart, but can also cloud your judgment in an emergency. Here are some insights into psychological preparedness and stress management for seniors. 1. Know your mindset. If you frequently worry about having a heart attack, acknowledging your fears can be the first step toward preparation. This doesn't mean living in constant fear. It means channeling your concerns into constructive actions, like taking a CPR course or organizing your medication. 2. Practice relaxation techniques. Mental and emotional stress can spike heart rate and blood pressure. Learning techniques like progressive muscle relaxation, mindfulness meditation, or guided imagery can provide tools to use when anxiety arises. Daily practice. Dedicate 5 to 10 minutes a day to deep breathing or meditation. Over time, this practice can help you remain calm in high-pressure situations. 3. Develop an emergency mindset. Rehearse mentally what you would do if you felt chest pain or other heart attack symptoms while alone. This mental rehearsal can help you stay calm and focused should it ever happen. Visualization. Imagine yourself picking up the phone, calling emergency services, chewing aspirin, and waiting calmly. This can cement these actions in your memory. 4. seek counseling or support groups. If you have a known heart condition or high anxiety levels, professional counseling can be beneficial. Support groups for heart disease patients and survivors offer shared experiences, tips, and emotional backing. Many senior centers or hospitals organize such groups. 5. Stay connected. Loneliness can exacerbate anxiety and depression, both of which negatively impact heart health. Engage with community activities, volunteer programs, or hobbies that bring you joy. A lively social circle can distract you from worries and provide quick help in an emergency. 6th, plan for pets or dependents. If you have pets or someone who relies on you for care, like a spouse with health issues, consider how you'd handle their needs if you had a heart attack. This plan might involve a neighbor or friend. Keep a list of trusted individuals you can call to look after your pets or dependents. Pet door or spare key. Simplify access for emergencies. 7. Limit negative triggers. If watching certain news or dwelling on social media triggers stress, limit your exposure. You can stay informed without overwhelming yourself with negative or anxiety-inducing content. 8. Recognize symptoms of panic. A panic attack can sometimes mimic a heart attack, adding confusion to an already stressful event. Learn to differentiate between them if possible, but always err on the side of caution and seek medical help. Even if it turns out to be a panic attack, it's safer to rule out heart issues first. 9. Celebrate milestones. Reward yourself for taking positive steps, whether it's maintaining a regular workout routine, cutting back on cigarettes, or consistently eating healthier. Celebrating small victories can boost self-esteem and encourage a proactive approach to health. 10. Acceptance and preparedness. Finally, understand that while you can reduce risk factors, you cannot entirely eliminate the possibility of a heart attack. Accepting this reality and preparing for the possibility is not pessimistic, it's practical and life-affirming. Facing fears head-on can reduce their power over you. By honing your mental readiness and managing stress effectively, you stand a much better chance of making clear, potentially life-saving decisions during a heart attack, even if no one else is around. 9. Recovery and ongoing care. After a heart attack. If you have survived a heart attack, whether alone or with assistance, the journey doesn't end when you leave the hospital. Recovery and ongoing care are crucial, especially for seniors who may face additional challenges during the healing process. 1. Follow-up appointments. Post-heart attack, your healthcare provider will schedule follow-up appointments to monitor your progress. These checkups might include blood tests, measuring cholesterol, blood sugar, and cardiac markers, imaging tests, an echocardiogram or stress test to evaluate heart function, medication adjustments, tweaking dosages or adding new prescriptions to manage blood pressure, cholesterol, or other conditions. 2. Cardiac rehabilitation. Cardiac rehab is a medically supervised program designed to improve your cardiovascular health. It often includes exercise training, activities tailored to your fitness level and guided by professionals, education, learning about nutrition, medications, and lifestyle choices for heart health, counseling, addressing emotional health, and adjusting to life after a heart attack. 3. Adhering to medication regimens. After a heart attack, you may be prescribed medications such as beta blockers, ACE inhibitors, statins, or antiplatelet drugs. It's vital to take them exactly as directed. Skipping doses or stopping abruptly can lead to rebound effects or complications. 4. Making home modifications. If you find that daily tasks are now more tiring or stressful, consider making small modifications at home. Install grab bars in bathrooms or along stairways. Rearrange furnishings. Create clear, open pathways to minimize fall risks. Keep essentials handy. Place frequently used items like medications or phone chargers within easy reach. 5. Physical therapy and other support. You might need physical therapy if the heart attack led to reduced stamina or if you have concurrent mobility issues. Occupational therapy can also help you adjust your living space or daily routines to accommodate any new limitations. 6. Watch for signs of depression. It's not uncommon to experience depression or anxiety after a heart attack, as the event can be traumatic and life-altering. Look out for symptoms like persistent sadness, loss of interest in activities, or trouble sleeping. If these feelings persist, speak to a mental health professional. 7. Ongoing lifestyle changes. Recovery is the perfect time to reinforce heart-healthy habits. Continue to focus on diet, exercise, and stress management. Even small changes, like incorporating 15-minute walks or swapping high-salt snacks for fruit, can significantly improve your overall health. 8. Family and caregiver involvement. If you have family or friends nearby, allow them to help with tasks that feel overwhelming. Accepting assistance, especially during the early stages of recovery, can speed healing and reduce stress. 9. Set realistic goals. Don't expect to bounce back to full strength overnight. Healing takes time, and each person's journey is different. Celebrate incremental improvements, whether it's walking a bit farther or climbing a flight of stairs without feeling winded. 10. Stay vigilant. Unfortunately, having one heart attack increases the likelihood of another. Keep up with all recommended screenings, communicate any new symptoms to your doctor immediately, and stay proactive about your health. The goal of ongoing care is not just to recover, but to thrive. With the right combination of medical advice, lifestyle adjustments, and emotional support, seniors can regain a fulfilling, active life after a heart attack. Surviving a heart attack when you're alone is daunting, but preparation, awareness, and swift action can significantly improve your chances. Knowing the warning signs, calling emergency services right away, and following recommended first aid steps are crucial. Just as vital is the preventive groundwork you lay. Staying active within your limits, eating a balanced diet, managing stress, and keeping up with medical appointments. For seniors, these steps are not only about surviving an acute emergency, but also about enjoying a healthier, more resilient life. Empower yourself with knowledge, take proactive measures, and share what you've learned with others who may also be at risk. Remember, while you can't always control if a heart attack happens, you can control how prepared you are to face it.